The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, oral surgeon Dr. Paul Metz improves his patient's life with dental implants. Learn more about the outstanding medical facility Houston Northwest Medical Center. Facial plastic surgeon Dr. Yadro Ducic discusses his philosophy on practicing medicine. Craniofacial and plastic surgeon Dr. David Jenikov discusses a special technique he uses for treating patients.
My life started with this desire to kind of house or hold all this reconstructive material for our patients, so we only had to do the surgery once. Because you can take stem cells from fat and you can treat that fat and separate those cells out, we then are able to do that and also save those cells for future use.
I was 13 when I was diagnosed with Perry-Romberg syndrome, and ever since then I've had little surgeries here and there.
Angela has Perry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence, and then slowly over time the tissue tends to just wither away.
My first 3 treatments with Dr. Jenikov were mainly just building it up, starting from scratch, putting tissue into my face, and then he built on from there with adding the silicone bone to my chin, adding the donor bone to the side of my face, rebuilding my eye socket, my nose.
If we know we're going to operate more than once, we don't want to go back in and have to harvest all that fat every time. So now we have the ability not only to remove the fat and store that fat, but we can also take the enrichment, the stem cells and regenerative cells that exist within that fat, separate them, and then add them back to another aliquot of fat prior to the reintroduction of the grafting process.
He's put tissue and everything to kind of regrowth, and it just makes it so that my appearance is that I'm normal on both sides.
We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. And that's why we developed this. Now it has application outside in orthopedics and cosmetic surgery and ultimately cardiac surgery and just general therapeutic issues. But it was started out for patients like Angela who have severe facial asymmetries who need repetitive operations. We can take that fat, store it, and then process it in such a way that we can better enhance their reconstruction later on. Then everybody's a winner.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Switching out that bag of chips with your sandwich to 3 ounces of unsalted pistachios will help raise your HDL cholesterol, which is the good kind.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in in 2 settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, We're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall costs significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's just satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day, specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
In my 20s and early 30s, I had 6 years of fertility treatments before I was able to conceive, followed by uterine cancer when my son was 18 months old. Both of those caused me to gain a great deal of weight, and I put it off and put it off and put it off, not thinking that insurance would ever cover the surgery. And then I went to see Dr. Frenzel, found out that it would be covered by insurance, had the surgery, have lost all of the weight, and I'm going on 3 years post-op now, and it has been wonderful.
We got Stacy approved. Let us do the same for you. Call now and begin your transformation.
Find your doctor on bestdocsnetwork.com.
At Houston Northwest Medical Center, our story began 40 years ago when a group of doctors took the risk of building a hospital in the middle of a cow pasture that was at the northwest side of Houston.
As a result of their vision and the quality that they provided, the hospital quickly grew into a regional healthcare provider serving not just the immediate area, but really all of North Houston.
When I joined the hospital 23 years ago, the things that stood out were, number one, the facility itself. The facility was second to none with respect to the services it provided.
Houston Northwest Medical Center is well known for the high quality care it's given since it's been opened. Since the first cardiac procedure in 1984, the hospital has continued to grow.
We do every kind of surgery, from the small to the large. We do from toenails to open heart. We have a very large bariatric program. We did about 500 cases last year.
As the years have gone on, we have been known for cardiovascular surgery. For cardiology procedures, we have a beautiful cardiac cath laboratory. Our OB department has just grown through the years.
Here at Houston Northwest, we have a lot to be proud of, not only in the quality of services we provide, but in the scope of services we provide. We are the third largest ER provider in the greater Houston area, and we're the largest outside of the medical center downtown.
The attention to detail is phenomenal, from the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
Brain tumors can be a very scary thing. I see a lot of patients who think they have a brain tumor. Most of the time they don't. Brain tumors are rare, but they can be very bad. So how do you know if you have a brain tumor? Well, headaches from a brain tumor usually are severe. They usually progressively worsen in severity and in how frequently they occur. And often they occur in the middle of the night. A headache that awakens you in the middle of the night is always a red flag to be checked out. Doesn't mean it's a brain tumor, but it just means it needs to be checked out to be sure. Also, if you have a brain tumor as the cause of your headache, you'll likely have other symptoms. For example, vision changes, double vision, numbness or weakness in one arm or one leg, inability to speak, maybe even a change in your bowel or bladder habits. So if you have any associated symptoms with a headache, or if it's a headache that is new, different, severe, and progressive, then talk to your doctor. Those are danger signals that need to be checked out.
Hello everyone, we're in the studio today with one of the top facial plastic surgeons in the Dallas-Fort Worth area. It's Dr. Jadro Ducik. Thank you for joining us today.
Thank you for having me.
Of course. So you're double board certified. Tell me a little bit about what other areas you specialize in.
Well, I do a fair amount of reconstructive surgery as well, so we deal with a lot of facial trauma patients, head and neck cancer patients, skin cancer patients, and it's a lot of those folks you're removing parts of their face and then reconstructing and rebuilding them, and it really kind of flows nicely into cosmetic surgery because you're doing similar sort of things. It's all about making people feel better about their appearance and function better.
So tell me, Dr. Ducik, you have a unique philosophy, and tell me what your goal is with patients.
Well, I hope it's not too unique. I'd hope that most facial plastic and plastic surgeons felt the same way, but you know, by the time a patient comes to see you, for whatever the problem is, whether it's a crooked nose, a mole on their chin, a weak chin, loosening of skin, whatever the issue is, they've thought about it for a long time. They've looked in the mirror, they've critiqued themselves, sometimes they've even shed a few tears. And so the last thing we need to do is to make them feel more uncomfortable about other things. And so I think it's important to address what their concerns are, recommend procedures or surgeries if they're appropriate, and reassure them that they'll do fine even if they don't have anything done. Because the most important thing you want is for them to walk out of the office feeling good about themselves. And the most important thing we want after surgery or procedures is for patients to feel good about themselves. The last thing we want is to create more anxiety by pointing out other flaws, which all of us have. That's what makes us human.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Every day I get to make people feel good about themselves, and I wanted to feel good about myself again. Look at me now, I'm a brand new person. I make time for what's important. Now nothing passes me by.
My family means more to me than anything. So now I exercise and make healthy choices. My one reason was my family.
My one reason was for me.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Request an appointment on bestdocsnetwork.com. Coming up on the second half of today's show, interventional cardiologist Dr. Annie Varghese discusses the signs and symptoms for those with an irregular heartbeat. Cosmetic dentist Dr. Guy Lewis talks about his philosophy and approach to practicing dentistry. Podiatrist Dr. Gabriel Maislos talks about using laser treatments for toenail fungus. Vein specialist Dr. Peter Morgan talks about the benefits of using the Claravane procedure.
Claravane's a new procedure. It's been out maybe for a year or so. It is a procedure that is associated with less pain, both during the procedure and post-procedure. Patients that have venous insufficiency that don't have it corrected are going to get worse. The question is, how fast will it get worse and how bad will it ultimately get? And that's dependent on the individual, how much of their problem is hereditary or genetic and how much is occupational. The typical presenting signs and symptoms, which include pain, swelling, restless legs, enlarged refluxing vessels. If you have the venous insufficiency corrected, the disease progress will completely stop, and if it recurs, it can be easily treated without significant intervention. When you use a laser or radiofrequency ablation to close veins, it's an energy source that produces heat. And so you're essentially burning the veins using radiofrequency or laser. And in order to control that pain, you have to put a tumescent solution, which is a numbing medicine mixed with normal saline, around the vein all the way up the leg. And so that requires several needle sticks, which is uncomfortable, and then that makes the leg kind of full, maybe a little tight. There's some leakage of the fluid. And with the Claravane, that tumescence not needed because Claravane basically has a mechanical agitator, like a skip rope, that spins inside the vein and traumatizes the lining of the vein, and then we inject a sclerosant solution that augments the effect of the skip rope. When you use an energy source, there's always a risk that you could damage a structure that's adjacent to or near to the vein, such as a nerve or maybe even muscle, that sort of thing. And so with Claravane, since there's no laser, there's no radio frequency, you're not using a heat source, and so it's, I think, significantly safer. All of the procedures are very safe statistically. The number of complications is very minimal, but I think there is some benefit with the Claravane with respect to complications.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Over 90% of diseases are caused or complicated by stress. Some ways to help deal with the stress in your life are exercising, listening to music, writing in a journal, or going for a walk.
I was quite tired, and I travel considerably, and at that time I would go through an airport and I'd have to stop and rest, and so I realized that I needed to check in with a doctor and see what was going on.
So Mr. Richardson has cardiomyopathy, ischemic cardiomyopathy from coronary artery disease, multiple blockages that really weakened his heart over time, and that's how I found him many, many years ago, about 15 years ago.
pretty common that you neglect yourself. You think nothing's ever going to be wrong, but I found out I had high blood pressure and I was border diabetic, and did a CAT scan, and during that time they found out that I had an irregular heartbeat. So at that time I was told I needed to go to the emergency room, and next thing I knew, I was having a quadruple bypass.
We were able to intervene on his cardiovascular disease, coronaries, fix those, but what happened was the heart was so weak, so he ended up needing a device, which is different than a pacemaker. It's the shock box. A defibrillator is put in under the skin, and again, like the pacemaker, the wires will go to the heart, but then this box is able to protect the patient, shock them, if the heart stops, or if the heart goes into ventricular fibrillation or ventricular tachycardia.
Well, I'm able to carry on my daily work duties, and I can travel, and I'm not so sure if I hadn't had this great care that I would have been able to do that at my age. I'm going on 71 and still working every day, so I give Dr. Varghese lots of credit that she's helped me sustain a good life.
He's been able to function normally, and it has actually improved the function of his heart. He can walk around, he's not short of breath, he can take care of his thousands of employees and customers, and what a blessing that's been for him.
For more information on this doctor, call now or go to bestdocsnetwork.com. Ask our doctors on bestdocsnetwork.com.
Well, the spa dentistry concept is something that I am considered one of the pioneers in the spa dentistry field, because I started doing this probably about 20 years ago. It feels like a high-end spa. It feels more aesthetically pleasing. One of the things we started with was just, how the staff was dressed. A lot of them we dress in black, which is a little classier looking. When you walk in, you can tell you're not in your typical dental office. I mean, most people are like, wow, this is unbelievable, because it's very nice. It's kind of like walking to someone's living room. The rooms that I treat patients in are more like suites. They're big rooms. They're not real closed in. They have couches in them so that family members or friends can come in and sit and be with them if they want to. But we also have TVs that are not only up in front of you where you can see them when you're sitting up in the chair, but we also have TVs in the ceiling so that when you're laying back in the chair, they're flat-mounted large screen TV, so you can watch TV, watch a movie, be relaxed, have your own headset, kind of go away, not have to hear all the sounds that are going on. We also have massage therapists that could do foot massage or hand massage, hand paraffin treatments for ladies, especially. Guys like it too, but where they can dip their hands in the hot paraffin and get that done. Just little touches that make it different, make it more of a relaxing experience. Most people equate going to the dentist like a trip to the dungeon, and it just doesn't have to be like that. It can be nice, it can be comfortable, it can be actually relaxing. And we have a lot of patients who tell us, I love coming here and I love getting this done. It's no big deal. It's not like, I heard my parents talking about. This is totally different. So we've done a lot of different things to try to make it different from just the norm and different from what everybody else is doing, and make it special, make them feel at ease.
For more information on this doctor, call now or go to bestdocsnetwork.com.
John has a question for Dr. C.T. Nguyen. Is it bad to breathe out of my mouth?
Yes, mouth breathing can be harmful to your health. Mouth breathing can cause tiredness, lack of concentration, snoring, dental problem, and it can also depress your immune system. please consult your ear, nose, and throat specialist for a solution.
To combat bad breath, use a tongue scraper to remove bacteria from the back of your tongue. Some studies suggest that adding tongue scraping to your regimen may be slightly more effective at eliminating breath odor than just brushing your teeth.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Watch more videos on bestdocsnetwork.com.
I came for the treatment for my toenails most of all, but all my all my toenails were bad, really bad. They were in bad shape and they were discolorated, like some white stuff on them. How to say? They were disattached from the nail bed in one place especially, and was kind of yellowish too.
Ms. Ina Yoshova came to my office complaining of fungal toenails. Very common thing, especially you see it in summertime. It's very prevalent. It's a fungal infection of the nails. The nails are discolored, and she wanted them treated.
I keep my body in shape, and I want to be healthy, and I want to have everything perfect. So it's one of the things when I found out that something is wrong. I couldn't go for some time because I was busy, but I told to myself, no, I have to.
It's basically a YAG laser, and it creates this intense heat, and it kills fungus, bacteria, virus, and it kills it at the root of the nail. That's where the nail begins. From that point on, we have a protocol in place to prevent reoccurrence, because probably most of the problems that have occurred in the past is even prior to the laser with the oral medication was that you would get rid of the fungal infection and then it would come back. So you also have to do your part to make sure that you don't get a recurrence, because once you're susceptible to fungal infection, you remain susceptible the rest of your life.
I figured out that I have good results because when I could see there my nail growing, the new nail will come pretty and doesn't have anything, like no fungus, nothing, no discoloration. It was pretty and nice and healthy nail.
The risk of a fungal infection is not just the appearance, and so you don't want to wait on it. You want to make sure you come in early because you don't want to go to that severe category where you might require multiple treatments. It's better to treat it early on. Not only that, the nails, when they become fungal, they become yellow, thickened, discolored, hypertrophic, and you can develop ingrown toenails. That's a serious risk because that's an infection, and that requires a surgical procedure.
I got new nail bed, new nail, and it was like pretty healthy.
For more information on this doctor, call now or go to bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.